Hi guys, welcome back. So today I want to talk to you about IPL. IPL stands for Intensed Pulsed Light. It's a light therapy. Another commonly used term is phototherapy. IPL looks for browns and reds on the skin. It is used to treat brown or red acne scars, acne itself, sun damage, broken blood vessels, rosacea, poikiloderma, and more. Poikiloderma, for those that don't know, is a condition caused by a chronic sun exposure that causes reddish brownish appearance, primarily found on the neck and chest. IPL can be also used for hair removal. However, it is definitely not a gold standard and not the best option for that. Unlike laser, IPL sends out a variety of wavelengths filtered, and that gives us more versatility. We are able to treat more conditions at the same time. So how does it work? So the light is delivered through the handpiece, and it targets what we choose for it to target based on the wavelengths of the filter that we choose. So if it's brown, the light goes after pigmented cells on the skin. The clusters of melanin cells absorb the light. That light gets transferred into heat, and it damages the melanocytes, those clusters of melanin that cause that brown spot. The brown spot crusts up, and then it flakes off over the next 10 days, and it looks lighter. If we're targeting blood vessels, the light gets absorbed by the hemoglobin, the red in your blood, and it gets transferred into heat, and that heat makes the blood vessels walls collapse, and therefore the blood vessel disappears. If we are treating acne, the light goes after acne-causing bacteria and sebaceous glands. So as you can see, IPL causes overall improvement of your complexion, causes more even skin tone. Usually we do IPL in series. Anywhere from 1 to 4 treatments are recommended based on the condition that we treat, and the treatments are spaced out every 4 weeks apart. But even with one treatment, some patients can see up to 70% improvement in their skin. As far as downtime, there is none. The brown spots appear a little bit darker for about a week, and like I mentioned before, it crusts up and then it flakes off in about 10 days. Blood vessels, when we treat, some of them disappear right in front of our eyes. Some turn purple and fade over the next week. After the treatment, your skin may be a little pink, but that subsides, and even if you have any discoloration on your face from the treatment, it's nothing that makeup cannot cover. As far as the comfort, the treatment feels like a rubber band snapping on your skin. You definitely feel it, but it's tolerable. Most people tolerate it without any topical anesthetic. Now, for maintenance treatments, we do recommend usually 1 or 2 treatments a year once you complete your series or a few treatments. How long the result lasts really depends on how well you take care of your skin afterwards. And after each treatment, I go into detail on the post-care and what you can do at home to prolong the results of the treatment, how to enhance and further the effect of the treatment, because you want to protect your investment. Now, we do ask you to stay out of the sun 2 weeks prior to the procedure and 2 weeks after. If you are using Retin-A, we also ask you to discontinue it a week prior to the procedure, because it is a photosensitizing product. So that's that about IPL. Besides the benefits that I mentioned, IPL also gives you that luminosity to the skin. Your skin just looks healthier. The benefit of it also that the heat stimulates collagen production, so your pores appear a little bit tighter, fine lines appear smaller. It just, your skin just looks healthier and more youthful in general. So I love IPL. I hope you enjoyed this video, and I hope I get to see you soon for some treatments. Bye.